Hi, my name is Dimitrios Daskalou and I study how radiation therapy affects hearing. Imagine having a tumor, primarily causing hearing loss, tinnitus, and vertigo. Now imagine that the very treatment designed to treat this tumor can independently increase your risk for hearing loss, tinnitus, and vertigo. This is a dilemma faced by many patients dealing with vestibular schwannoma today. And I believe that we should address this challenge. Let me explain how. A vestibular schwannoma is a tumor that grows on the nerve that connects the inner ear to the brain. This nerve carries information about sound and balance. There is an effective treatment for this tumor. It is a type of radiation therapy that allows for the precise delivery of beams of radiation to a specific target. But there is a problem. The inner ear is very close to the tumor and receives some of these beams of radiation intended for the tumor, and that is causing hearing loss. Most of the damage happens because of reactive oxygen species, unstable molecules that are harmful in large amounts. Currently, we cannot predict or prevent this damage. My research project aims to address these challenges by predicting which patients might experience hearing loss after radiation and by developing a method to protect the inner ear from the damage. To begin with, I analyzed patient records and imaging scans to identify patients at risk for hearing loss after radiation treatment. Reliable predictors would allow us to provide these patients with appropriate counseling, support, and hopefully with a protective treatment in the future. The search for this protective treatment is done in mice. Here we focus on an enzyme called NOX3. NOX3 is found exclusively in the inner ear and it is important during its development in mice. And we think that NOX3 is also the main source of excessive reactive oxygen species when the inner ear is exposed to radiation. So, my goal is to see if blocking NOX3 can protect the inner ear. To test this, I treat mice either with a treatment that specifically targets and blocks NOX3 or with a control treatment. All mice are then exposed to radiation and I measure their hearing at 1 week and 1 month. We hypothesize that mice treated with a NOX3 blocker will preserve their hearing when compared to the control group. So, how can these results benefit our patients? This approach is not just for mice. It could also work in humans. And so, if the study is successful, it could pave the way for testing this treatment in vestibular schwannoma patients. My hope is that in the future, our patients won't have to face the same dilemma, and treating vestibular schwannoma will no longer come at the cost of their hearing.